And I thought maybe I'm just out of it. Maybe I didn't, have a great breakfast, or maybe I was doing too much. But lo and behold, it kept occurring. And carrying my son inside, he was asleep. When I got inside, I was just winded, totally winded, sweaty, but no pain. So I eventually went to my primary care physician, and I thought, I need to look into this. And he said, oh, you're having panic attacks, you're stressed. He ran all the tests, and they came back, there was nothing, no cholesterol, no blood pressure, no diabetes, don't smoke, was not overweight, so I didn't have those typical risk factors. And so he just kept saying, maybe you should, take 3 days off from work or take Xanax. And I was like, at 30, what is Xanax? And he's like, you're doing too much, basically, so we all know what that is. So I thought, well, can I see a cardiologist? And finally, he sent me to one, and he says, yeah, you can call a cardiologist, but I don't think it's that. You probably just need to relax. You probably are doing too much, and you just need to take some time off. Well, eventually I went to see a cardiologist at Ochsner, one of my favorites. He's retired now, Dr. Sheryl. And I was there with him, and he said, yeah, if you were 15 years older, we would immediately run several tests on you, the stress test, etc. He said, but let's just start from the beginning, which he did, which took several months. We finally got down to it from the EKG and everything. It came back and said, she's fine. Then eventually he did the stress test, and that told the full story that I had something wrong. He then scheduled the emergency angiogram, which showed that I had 98 and 95% blockage in 2 arteries, and then did the angioplasty. And so you could just imagine at 30, I'm sitting there like, what? I'm in recovery, and then he comes in and he says, now you have heart disease. And I'm like, what is heart disease? And then he's like, yeah, you're going to have it forever. You have to see medication, you're going to have to change your lifestyle, which I was already pretty fit, personal trainer, doing all the things. And I thought, well, what more could I do, But that's when I decided in recovery, my mom laughs, I said, this is going to be a success story. At 30, fit. People looked at me and they were like, you, heart disease? Like, how is that even possible? But, now we know heart disease does not have an age or race. It doesn't, look like anything in specifically. And so, from that point on, I just was determined to share with women all over the country about loving your heart now and what we could do for our heart, since we know it's the #1 killer and 80% of heart disease is preventable. And so that was my mission for the first 10 years, was to just go out and share, my story with as many people as I could. And that's what I did.
Thank you. As you were talking, that actually just triggered a thought with mine that I had for Dr. Williams. So as she was speaking, one of the things that came to mind is how women and their presentation for heart disease. Can you speak a little bit about that in terms of health disparities that women experience in terms of cardiovascular disease?
Absolutely. But before I answer that question, if you don't mind, since I have a couple of things for you to have to complete my medical history taking. Did you know preeclampsia was in type?
No.
What about diabetes or preterm delivery?
No.
No complications whatsoever?
No.
So for someone like herself, who's 31, not only are the symptoms not typical when we talk about heart disease, classic heart disease we refer to it as symptoms that come on with activity, but it tends to be more pressure-like or heaviness on the chest. But oftentimes women have, they may not have those symptoms, or they may be subtle or atypical. So maybe it's burning with activity, maybe it's, in your case, just feeling really drained or feeling wiped out with activity. And then also when we think about younger women, we have to think about pregnancy-related complications. So in a younger woman, even though they may be healthy, if they have something bad happen to them during pregnancy, whether that's preeclampsia, high blood pressure, diabetes, that increases their risk of cardiovascular disease and stroke. And so we're seeing younger women at an age of, 35, 40 years old, who may look healthy on paper, but their arteries tell a different story because of their history. So it's definitely something, to be mindful of. And I always tell my patients, especially when you're a younger woman or a woman in general, because your symptoms may not sound typical, you have to, one, advocate for yourself, and then two, find a provider that you feel comfortable with. So if someone tells you that you're okay, but deep down you have an unsettling feeling, then I encourage people to go after that feeling and really find someone who will listen to you.
Thank you. So you both spoke about advocacy and speak up for yourself. And so this being so, I was wondering if you could tell us a little bit more about your nonprofit. How did you start down that journey?
Yeah, what a journey. So after the 10 years, I share my story with any woman that I could find, right? Everywhere. And then at 10 years, I thought, well, how can I get now ahead of heart disease? Like the 80%, where is the 80% of women that can stop, heart disease? And so then I thought, it's the girls, and I said, I want to start a nonprofit that focuses on our girls. And that's how Heart and Hands was born. We educate girls 10 through 18 about heart health, heart disease prevention, in very fun, interactive ways. So while they're having fun, they're dancing, they're trying new fruit, new veggies, we're really getting them fit and active. They're also learning about how the heart works and the importance of what you do for your heart now, today, will impact your body in the long run. So I love the message before about not to really compartmentalize your health, and it all goes together. So, one day the young girl said, well, Miss Essence, why do we keep talking about the heart? Every day you come, we talk about the heart. And I said, well, think about how important your heart is, right? If you don't have your heart, what happens? But we don't think about it until it's too late. And so the advocacy is all about, when you feel something is just not right, you have to speak up. You have to say what is going on and explain to your physicians what's happening, what you're feeling, so that they can then, give you that proper diagnosis. We also teach them things that are very impactful that they can take home, right, to their families, their grandmothers, their entire family, creating generational health. So we know that young girls are going to be the bosses of the family. They're going to do all the caregiving, right? The doctor's appointments, the grocery shopping, the cooking. So why not educate them at an early age so they can take that throughout their lifespan? And so, it's a lot of fun. The organization really takes pride in changing the mindset of what heart health really is, because people don't like to talk about the heart or heart attacks and stroke until it's too late. And now what are you going to do? You're faced with so many other things that you have to tend to that, you forget about the prevention, and you don't even think about, how you can be proactive with heart health. So in a nutshell, that's kind of the goal of Heart and Hands.
So I like that you're tapping into the youth and sort of getting ahead of it at earlier age, right? Because we have generations after generations after generations after generations, and we just want to use it. One of the things we learn is not to talk about it. And you just mentioned about the importance of talking about it. So we have family histories that that's kept secret, as we don't talk about that with other people, right? But unfortunately, that is your risk factor, and that how do we become more open about talking about these things, to be more educated about it, to take care of ourselves. And so I really appreciate the perspective that you're bringing to it. And I can see that Dr. Williams and Dr. Martin-Schild have something to say as they keep doing this. So I'm gonna let y'all chime in real quick before I go to the next question.
So you brought up a very good point about prevention. And from a cardiologist perspective, I love to hear that, because when people present, it's not something that happens overnight. So it's like a storm brewing in the background, and then that one day you have an event. And so prevention is key, and starting with the youth, I think it's amazing, because that's where we start to see things happen. So that's very important. The other thing about family history is, I'm happy that you brought that up, is because just last week I had a patient tell me that they do not like to answer family history questions. And when I probed, they said that they do not want to be treated like other people with their family. They want to be seen as an individual. And so it was a good opportunity to have conversation and education around me before it gets to family history. And then also, at the end of that conversation, she actually said, I'm actually going to go back and talk to my family about their medical conditions. So I think that's great, and we need to be speaking about that and talking about that a lot more.
I'm going to just jump in real quick. So a part of the Heart and Hands programs in our activity books that we give them, there is a family tree. And so we have them take that home, and when we come back and we have questions about risk factors for heart disease, and we, there's interview questions so they can sit down with their family members, and then they bring it back to us, and they are so excited to share what they found out, get discovered from their family, or how, great grandmother passed, or, their family members that had heart disease, and what that means for them. And so we do educate them. And we bring in doctors like Dr. Sheryl Martin-Schild, who is very active and on the board of our organization, to share the impacts of what heart disease does to a family. Yeah.
So a couple of things. One, we really need to destigmatize medical condition. I think that so many people are embarrassed when something doesn't work like it's supposed to. Even simple things like having a high cholesterol. People are embarrassed that something's not normal. And we really have to try to get rid of that and recognize that things happen to you over the course of your life. And with Heart and Hands, teaching the next generation of mothers that things that you do, even in your youth, really make an impact on your long-term medical condition. And we know from studies like the Bogalusa Heart Study, which was done here in Louisiana, that even teenagers have evidence of atherosclerosis developing on their aortas based on their family history. So some of it's genetic and we can't do anything about it, based on their activity level, and based on their dietary choices. So we know that we can make an impact on your long-term likelihood of surviving without heart disease or having a stroke based on what you do. But we have to establish those patterns. We have to let the children become aware that what they do makes a difference. And so much of that comes from their parents feeling comfortable explaining to their children when they have a diagnosis how they got to that and what they're going to do about it to keep it under control so that they don't have long-term problems. I mean, we have a disease in our city, at many other places, which is that women particularly sacrifice themselves for the benefit of their families. They always have enough time to take care of what has to be done for their children or for their partner, but they don't protect time to invest in themselves and their own personal health. And I can also say I'm not embarrassed, or I mean at one point I was embarrassed, but I'm no longer embarrassed to say that I did that for decades. I didn't prioritize myself. And I was not in great health. I was on 3 blood pressure medications. I had really high cholesterol, and I weighed almost 100 pounds more than I do now. And I had a wake-up call. And I'm like, God, how many patients that I sit across from and tell them what they should be doing look to me and are like, okay. But so I finally got it together when my daughter, who's a junior board member on Heart and Hands, made a comment about my body one day and said, well, you're just a little chubby, Mom. And I was like, what? She'd never said anything to me like that before. And instead of fleeing from the scale, I embraced it. And now, I embrace active participation in my own physical health and trying to lead by example for my children. Thank you. They say that care providers are the worst patients. They are. And I'll admit, I've had hypertension since I was in mid school, so I was like in my early 20s. But I'm a digital hypertension program participant, so I'm an advocate for that. So I'm going to bring it up again because it has been helpful, even for me as a physician. There, like you said, there are things that we tell patients, and then you go home and it's like, I'm not following those instructions. Right? So we can't give out advice that we can't even do for ourselves. And the same follows for women who are taking care of their families that we do. There's nothing wrong with putting yourself first, because you cannot take care of anyone else if you do not take care of yourself. That applies to all of us. So I wanted to bring up stroke, because you're our local expert, right? So we've talked a lot about heart disease, but stroke is the #1 cause of disability worldwide. And so I was hoping you could kind of speak to that about where we are in Louisiana, what do we need to do? Well, Louisiana is part of the stroke belt, which is the part of our country that has the highest incidence of stroke and higher mortality from stroke than other parts of the country. And so much of it is genetic, a lot of it is environmental, and here in Louisiana, one of the things we're known for is our delicious cuisine and having a great time, which often includes more alcohol than you should have. And all those things take a toll on your body. At some point, people have decided that food is supposed to be your break and delicious. And you can make your nutrition delicious, but it's really the goal of food is to provide your body and your brain with everything that it needs to function optimally. And if you don't put the right nutrition in your body and your brain are not going to function as well as they should. We do have a lot of stroke here, and as you said, stroke is the number one reason why someone would have a new disability and the number one reason for nursing home admission. And there are tremendous disparities that we have in Louisiana and many other parts of the country. Studying more about on the solution side, right? So we know we have high rates of stroke, disparities across different populations, and earlier we just spoke about those risk groups that are disproportionately impacted in Louisiana. But I want to focus on solutions. And so what are we doing in the state of Louisiana to tackle the problem? Not only from the standpoint of diagnosis and treating strokes, but the rehab part of it as well. There's a lot to unpack there. So there's different types of stroke. There's the bleeding kind of stroke, and then there's the clotting type of stroke. And the clotting type of stroke is 80+% of all types of stroke. And we have highly effective treatments. But to get those treatments, you need to get access to emergency care as fast as humanly possible. With every single minute that passes, the treatment effectiveness goes down, and the risk goes up, and the odds of recovering without independence drastically goes down. And after a certain amount of time, the treatments don't even offer any benefit and won't be provided. Depending on how severe your stroke is, there's treatment like a clot buster, which can be given in your IV. It's like Drano for the braino. It circulates, and if it finds a clot, it can dissolve it and restore blood flow. And if the brain cells aren't already permanently damaged/dead, then those cells can come back, and then your function comes back. And then there are strokes that are caused by large arteries that are obstructed by a clot. And the treatment for that can be the clot buster, which can help in many of those cases, but often it requires what we call a plumber, a proceduralist, a doctor, and there's lots of different disciplines, and that involves going in like an angiogram for your heart, but instead we have devices that can pull the clot out, and that has been shown to drastically increase the chances of having an independent outcome from your stroke compared to if you don't get it. But again, every minute matters. Up to 2 million brain cells die with each minute that passes. And like I said, that requires specialized proceduralists. Not every hospital has access to that treatment. And that wasn't very many years ago. It was only 2014 where that treatment was even shown in a clinical trial to be effective. And we knew it would work, but we just couldn't get data that showed that it was effective. But now we do, and more hospitals are offering it. But at one point, there was only 2 hospitals in the state of Louisiana providing it. And then it became 3, and it became 4. But we still have tremendous regions of our state that can't access that procedure without at least an hour of transportation time. That's 120 million brain cells if it takes an hour to get to a facility. But guess what? Most patients in our state are presenting to a hospital by private vehicle. So patients don't know which hospitals have that procedure available. Not even all hospitals even have the clot buster. Not even all hospitals even have a CT scanner 24/7. Many have to call the tech from home to come and scan to even distinguish between bleeding kind of stroke and clotting kind of stroke. And then if you identify somebody in one of those smaller hospitals that needs to get that procedure, now you have to have an acceptance by a hospital that has it, and then you have to get transportation set up, which might be in air medical, maybe helicopter or plane, or could be ground transportation. And if we look at how long it takes from the time a decision is made to transfer a patient until the time they exit the first hospital, to then have however long, an hour, maybe more, to get to a hospital that has it, the median time was 2.5 hours a couple of years ago. So one of the main efforts that Louisiana Emergency Response Network has put into place is reducing that door in, door out, that time went from arrival to a hospital that doesn't have the resource that's needed to leaving that hospital to get to one that does. And I can tell you that we've made tremendous progress. The most recent quarter data, it was down to, I think, 105 minutes from like 150 something minutes. So we've shaved off a lot of time, but there's a lot more work to be done. Like getting patients initially to the right hospital, if possible, without spending additional time to get there, and then recognizing the right patients for the right treatment and trying to get them access. So, you know, the rural areas have tremendous disparities, and there's even urban areas, like the entire central part of Louisiana, like Alexandria, none. There's not a single hospital there that offers this procedure. And Lake Charles area, you either go to Lafayette or you go to Houston. There's nothing down in the bayou. But New Orleans is like the Mecca. We've got several hospitals that can offer that procedure. Baton Rouge, Lafayette, and Shreveport. And there's actually one hospital in northeast Louisiana, the Monroe area, that can do it like certain days of the week. And only during daylight hours. So there's huge gaps in providing the emergency care needed. And then you fast forward to like rehab. So there's big problems with gaining access to rehab. We have clear data that shows that following a stroke, if you meet certain criteria, that going through inpatient rehab offers a better outcome, gets you better, more independent, and also reduces 30-day readmissions. You have to be able to benefit, and you have to have a significant enough deviation from your baseline, and you have to be able to show that you can learn and carry over, and you have to be able to tolerate the 3 hours of therapy. But the difference in getting 3 hours of therapy 6 days a week and getting 30 minutes of therapy 5 days a week in a skilled nursing facility is drastic. And that's your peak recovery time in the first 3 months. So can you imagine you're in an area that doesn't have inpatient rehab, right? Let's say you got to the hospital too late to get any of those advanced treatments, and you were admitted, and now you're ready to leave the acute care, and your therapists are all saying inpatient rehab. But you don't even have an inpatient rehab in your city. So now you either have to transfer to a urban area where they have an inpatient rehab, and now you're physically separated from your family. They're not there to benefit from the family training that needs to occur so that they can even have an awareness of whether they're going to be able to handle your needs and get you home instead of having to go to custodial care. And then on top of that, we have patients who don't have like the knowledge or the baseline cognition to advocate for themselves, or maybe their cognition's impacted by their stroke, and they're not even aware of what their options are. So you have hospitals that are trying to save money and shave the expenses, and now they either wait for sometimes a week to get you accepted into a rehab or get you over to a skilled nursing facility. So then your care is compromised and you don't even know it. And then at another level, I mean, if you've got federal Medicare or Medicaid accepted, bam, and you're in rehab. If you've got a managed Medicare or Medicaid plan, the denial rate for inpatient rehab is very high. Mm-hmm. And then you have to rely on your healthcare team to advocate for you to get an appeal.
And that appeal, depending on the plan, can take anywhere from 48 hours to 30 days. It's terrible. Don't let it depress you. But, so if you think about like families that are close and can advocate for each other and are present and engaged and have know the questions to ask from the care team, compared to patients who don't have that family support, that's another disparity. So the key is to not have a stroke. Okay. And 80% of all strokes are preventable, and it all starts off with having a healthy heart, because that's the root of at least 30% of all strokes is having either structural or functional or rhythm changes happen to your heart that predispose to clots forming and traveling to your brain. But being aware of all of your individual risks and doing everything you can to lower that risk, and knowing how to recognize and respond to stroke when it happens is so important. If I were to leave you with a couple of things, it would be, when in doubt, check it out. It's okay to overreact and be told, oh, it's just a migraine, or oh, it was just this, or you slept on your arm wrong, or something like that. It's okay to overreact, but if you don't react quickly, you may lose the opportunity to get treated for stroke and then have the long-term consequences of that stroke on your long-term functional abilities. And the types of symptoms that you should realize represent stroke. Really, any sudden loss of function is a stroke until proven otherwise. So if you suddenly can't move a finger, it's not because something happened to your finger, unless there was trauma to your finger. It's probably because something happened in your brain that stopped allowing your finger to do what your brain was telling it to do. But ultimately, be fast is the acronym to know. If you're having a stroke, you better be fast and call 911. And the B stands for a sudden problem with balance or dizziness. I'm not talking about the kind of dizziness where you turn your head and for a second you're like, woo, or the kind of dizziness when you stand up and you feel a little lightheaded. I'm talking about a feeling of loss of balance or an illusion of movement that's not clearly triggered by something. The E is any sudden problem with your eyesight, whether it's loss of vision in one eye, double vision where you see two of something and there's only one, or trouble seeing on both sides at the same time. Like if everybody holds your hands up and wiggles your fingers, you should be able to see everything from there to there. But if you had to turn to see something you normally can see, that would be a sign of a stroke. And so many people have sudden onset of a problem with their vision, and what do? They schedule an appointment with their eye doctor. And then they see their eye doctor the next week, who sends them to the ER with a note that says they've had a stroke. So any sudden problem with eyesight is a stroke until proven otherwise. And then F is for the face. So if one side of the face doesn't move or feel like the other, the A is for appendage. So any arm or leg, sudden weakness, numbness, or clumsiness. S for sudden problem with speech. And T for a sudden onset of a terrible headache. Any of those is a reason to call 911. Not just one. Having more than one increase in the odds that it's a stroke, but any of them should be a trigger to call 911 immediately.
Well, I am depressed. But that puts some powerful information. She just shot out so much stuff, and I hope you took notes, because I was going to ask her the BFAST acronym, and she just brought it out and told you, these are the signs and symptoms, and that's the most important thing I would say from the community perspective, that for yourself and for someone who you're in their presence and something happens, to recognize the signs and symptoms that they're having a stroke. You could be in church and something happens, right?
Every Sunday.
It happens. It does happen in church. So be aware of those things that you can pick up on it. So I wanted to kind of put the question out for all of you. So there's on the one side what we as a community need to do to empower ourselves and be knowledgeable. But I want to take it back into the healthcare system as to, and I want each of you to answer this from your own perspectives. What additional education do you think providers need to have? So that's your physicians, your nurses, all of us who work in the healthcare system. Based on your experiences, what extra training do we need? What extra awareness do we need in order for us to do better by our community in terms of heart disease and stroke management?
I'll go first. A couple of things, though, that I wanted to comment on. Because obviously the problem is, multi-levels, and there are only certain things that we can control. We can't control, putting, hospital, in this area, or, there's difficulty with recruiting physicians for some areas. But I do think that awareness and education at a community level comes first. And then going back to the point you made about the stigma, getting rid of that stigma and really encouraging people when they have events to go back to their communities and educate them on the things that they've learned. And then also, even use that to, advocate at a local level, for policy change, because a lot of these things are not going to change unless policies change. And the only way that policies have to change is that, we have to speak up. So as healthcare providers, I think from our standpoint, sometimes it is difficult to have enough time during visits to actually sit down and educate the patient. So a lot of times we are, especially when people are doing good, we say, great, you're doing well, continue your same regimen, I'll see you in 6 months. Instead of sometimes taking that time to say, okay, well, let's go over, why don't you tell me what you understand about, your disease? Why is it important to control it? What type of things, can happen if it's not controlled? Because sometimes that education piece I find is all that patients need. And they're like, oh, that's why it's important that I take my blood pressure medicine. That's why it's important that I do these things. So we're not focusing on so much a number, but we're focusing on, how is this helping me in the long term? And I think when patients can understand the big picture, that really helps with compliance, and it also makes them feel like they're taking, the driver position in their health, and we're just here to support them.
Yeah, you could ask at the end of your visit with your provider, what is the number one thing I need to work on to lower my risk of fill in the blank? Whatever your biggest concern is, heart disease or having a stroke or developing dementia. I try to give my patients at least one concrete thing that they should work on between that point and our next visit, so that they can focus on that. And then I'll say that the number one reason why patients don't get treated for stroke is because they do not present to the hospital on time. And getting our community to understand the concept that every minute matters is very challenging. I mean, we have entire talks dedicated at the level of resident physicians to teach the concept of what we call the penumbra, the part of the brain that if it could have return of blood flow immediately could still survive, and how that penumbra shrinks over time and the dead brain increases over time until it's completely done. So why should we expect somebody to realize that if they, let's say, developed left-sided weakness at 2 o'clock and they have to pick up their grandkids from school, why would we expect them to think that there's any difference in their outcome if they decided to come after their daughter comes home from work at 6 and ask her to take them versus go immediately? Why should we expect anyone to understand that there's that risk to long-term outcome? So now that you know that, share that with friends and family. Share that be fast. Practice it. Practice knowing how to screen someone when something suddenly isn't right. Are you feeling dizzy? Do you feel like your balance is off? Are you having any problem with your eyesight? Have them smile. Have them hold out arms and see if one side drifts. Check each leg and see if one side drifts. Ask them to name something, repeat something,
Follow instructions without giving them, visual or tactile cues. Ask if they're having a headache, and if any of those is suddenly going on, just pull the trigger and call 911. And I'm sorry, but somebody who you think is having a sudden brain injury should not be allowed to make a bad decision that affects the rest of their life. So if your spouse is saying, no, I don't want you to call 911, you should not call anyway. Ask for forgiveness later, because they may not have the cognizance to understand why 911 is so critical. Because, like I said earlier, not all hospitals have the same resources. And our medics are trained to screen your exam and realize which patients can go to the closest hospital and which ones need to go to a more advanced center. And if you rely on that secondary transfer, that is going to cost a lot of time.
Right, so I think for me, at such a young age, I had gone to, my annual physicals, right? And you leave the physical and he says, yep, check, you're good, I'll see you next year. And anything can happen from that time to the next year. But had I asked before, right, about what are my numbers, my cholesterol, my glucose levels, triglycerides, because I was not informed, I didn't know, right? And most of us don't know. And so I think from an education perspective, it's like, one is listen to the patient's perspective, because I knew something was wrong and I was not going to take no for an answer. I just kept saying, no, something, it's just not right. The palpitations keep coming, I'm sweating, the nausea, like when I'm working out, like what is that? That shouldn't be happening to a 30-year-old. So that would be the first thing, is like, just listen to the patient as they explain it versus just immediately saying, because that person does not fit in that line of, what the diagnosis should be based on their symptoms, that, oh no, this can't possibly be happening to you. I know it's better now, it's 21 years later, and I hear so many stories now about, oh, there's so many younger people now that are going through what you went through, 21 years ago, which is great to hear. So that's number one. And then I think also another thing about advocacy education is, we have to be empowered. We have to take our health in our own hands, right? Or our overall health. And that means, you have to know your cholesterol. What is your LDL and your HDL? So now, I have a list of questions I develop and I share it with my girls and my family about, ask the doctor these questions. Don't just say, everything's okay, I'll see you next year, right? Sit down and ask them, what does this mean? Because even though your cholesterol, you're the experts, could be at a certain level, but your HDL is bad, right? You don't even know that, but they're gonna look at that total number and say, okay, you're fine, I'll see you back, next year. So I think it's all about us taking our health into our own hands and knowing the numbers, because it's important that we know what it means to us specifically, and then sharing that with our community, with our families, to just really create this overall healthy environment, right? We don't have to be at the bottom, as you mentioned. We don't have to be at the bottom of the list of states, right? I mean, we can improve over time. I mean, we've made so many great strides just from the work that we collectively do in the community. But, I know that if we personally took charge of our health and not necessarily compartmentalize our health and say, oh, I'm having this one issue, that one issue could be because of something else. And so I just think it's on all of us. The onus is on us to really pay attention to our heart health and sit down with our doctors and ask those specific questions and make them answer it, right? And don't take no for an answer. Get the answers that you need so that you have something to compare. You have baseline data. So now, with Ochsner, it's in the app, so you can look it up. You can Google, what does it mean? So when you have your next visit, you can say, where am I now versus last year? Did I improve? What do I need to do? You don't need to wait for the doctor to tell you that. I think that's very important, that we look at the doctor as our partner, right? We're collaborating with them on our health, and it's just not up to them to tell us what to do. We have to take ownership in that. So that's my kind of take on it.
That was like, drop the mic moment. I think it's important. We are collaborators, right? You are an equal partner in your health. And I am one of those doctors who teach my residents that you may be bringing something to the encounter from your medical knowledge, but you must listen and follow the patient's lead. If you want them to be empowered to take care of themselves, you must follow the patient's lead, right? And so that collaboration is something I just wanted to emphasize, that I think as a society, we always do hold up physicians in this, certain position, right? But this next generation of physicians, we're teaching them that we are partners, right? And I want the community to understand that and to feel empowered when you walk into the doctor's office. And I think the message that these ladies gave today about advocating for yourself is incredibly important. And if there's anything you take away from this conversation, it's the power of self-advocacy. With that, I see a couple of folks in the audience who approach me who have lived experiences. I'll let you speak, and then I have to go to our community partners.
Really quick, I just wanted to comment on the advocacy and the education. If you are interested in learning about something, ask your provider, where can I go to learn and read more about this? We have a ton of, knowledge, a ton of resources that we can actually share with you if you want to go and learn and read, because there's so much information, on the internet.
So a couple of you have approached me about the things that we've been talking about, and I think it's very powerful to engage you in telling your story and sharing with the group. Because just in those few minutes that I spoke to some of you, there was a lot that I learned in those few minutes that I think that the rest of the group here should hear. And I wanted to start with you all, from your foundation, if you'd mind sharing that with the group.
So I was pretty much like Essence, where I was healthy and everything. Took care of myself and I was at the gym. And I went to actually on the CAT scan table. They wanted to check me for AVMs. I had I had a stroke right there on the CAT scan table. And this is so 6 years from December 1st, 2019. But December 1st of this year made 6 years that I am a warrior, I like to call us, a stroke warrior. So they had to rush me to main campus to do a thrombectomy, which was, like the doctor said, I think some of the different procedures that they have now, which was awesome. It saved my life. I had a brain bleed, a brain swell. I had no blood oxygen to my brain, right side, for almost 3 hours. So the time frame was, I was shaking my head like, yes, that was my situation. I found all that after ICU. My husband was right there by my side, thank God. And so I came through ICU and went on to the neuro floor at Ochsner main campus, which they were amazing. Ochsner did amazing with me. But we come to see, it was, I watched him fight for he was my advocate the whole time, fighting to get me an inpatient therapy and things like that. And everything that you said was just right on key of what we've experienced. And we put together, just this year, we decided to start a nonprofit to help stroke recovery, to help stroke survivors to go through their recovery. And I'll let my husband speak now because I'm kind of distracted a little. Then he can explain a whole lot more of what we're about.
Yeah, so briefly in the recap, she was at Ochsner County for other pain. And on the CAT scan tables when it happened, they brought her back to the room. She left in the wheelchair, came back in the bed. And they began all the stroke protocol, the medicines, all of those things. They moved it to a different room. Blockbuster was put in. While the ambulance was waiting, we were at a care facility for Ochsner, and it still was 2 hours and 57 minutes before she actually got the thrombectomy done. There was no delays on our part. Everything had to do with transportation, facilities, opportunities, and then from there, we were denied over and over again. I've also been from neuro floor to inpatient because of her situation, because of the traumatic brain injuries that she had and the extent of it and the dead cells in her brain. But I continued to advocate for that. We're now partners with this facility on North Shore Rehabilitation, who accepted us Gave us 2 weeks, which changed her outcome. But as we got back home, spasticity set in, other things began to change in her body that led us to have to learn a recovery program on our own, because all she had was 2 days of outpatient recovery until insurance said no to outpatient, and then we would completely go out. So we started to learn how to use stimulating devices, start therapy treatments. Out of all of that began the birth of Pathways to Triumph, which we started this year, which is a post-acute recovery program that we put together where we go and help people in their homes navigate recovery with a dream and a vision to build a facility. Here in Baton Rouge, Louisiana first, that would bring people in for 6 months of recovery program, all non-doctor funded.
Thank you. I want to turn it over to our guest from Monroe, because you had as you were talking, I saw her shaking her head and wanted her to share.
Thank you. When you all were talking, it really hit home, because I was in California when I had my stroke, and it was my daughter. And I love what you said when you said, if you love your loved ones, don't let them make the wrong decision. I woke up one morning and I went to see my daughter, because she's like, you slept in. She's yelling. She's like, wow, get up, you slept in. And I had a job and I was loving it, but it was stressful. And I've gone to doctors. He said, oh, you just have stress. You have migraines because of stress. You know, you just overwork, just slow down. And I did that for 2 to 3 months. So I wake up and I'm stumbling in bed, but I don't think anything's wrong with me. And she looks at me, my daughter looks at me and says, we're going to the hospital. And she grabs my arm. I said, I'm fine. I just woke up late. She said, no, your face is drooping. She said, you're not talking. I thought I was talking English. I was talking gibberish. She said, I don't understand what you're saying, but I thought I was talking. And she grabbed my arm and took me to the hospital. We were close enough to the emergency room. So she just grabbed me and took me to the hospital. And it was a devastating ischemic stroke. And I lost all English, all language, couldn't walk, foot dropped, paralyzed on one side, didn't know what anything was. And I had my cardiologist say, my neurologist say to my family, just put her in a nursing home, she's gone, she's done. And my youngest said, showed my cardiologist a video of me, because I had the number on fit and I was measuring to the community. And she showed a video to him and said, this is who my mom is. Don't give up on her. And he petitioned for me to get into the best inpatient rehab for more than 3 months. And my husband, he left me road, he was in the middle of that, came by myself, stayed in the hospital, in the rehab every night, every day, advocated for being my children's out, getting home, quit their jobs, and help take care of me. And this is the result of immediate care and the result of advocacy, pushing the insurance to pay when they said no at first. But here we are in Monroe now. I live in Monroe, and it's taken me 3 years. I still don't have a neurologist to follow up with. I don't have a good cardiologist that's taking me serious. And it's just like frustrating. I've seen people, like he found one of his friends in the middle of a stroke. He is unable to do life right now because it took hours, right? How many hours is they just in the ER waiting room? And they told him you're having a stroke, but we can't do anything for you because they had to get transportation to Shreveport, and it took more than 2 to 3 hours. He's debilitated. He's not going to recover. We see this over and over again in the growth of the community members that they're going in with a stroke and just getting put in nursing homes. They're not even getting rehab. They're just getting put in nursing homes. And so it's just heartbreaking because in full of advocacy and medical treatment and rehab. And how do you connect these rural areas with what you know would save them? And save them, like you said, the family suffers. The whole family suffers when someone goes down. But also when you said these things, how the doctor said just take stress, how do we get doctors to listen to us? Because it was 3 to 4 months when I'm having migraines every day. Never had migraines in my life. I was tired, I was fatigued, I was out of breath, I was sweating, drenching. They're like, oh, you just overworked. You have a high stress job. No one was taking me serious. How do you get doctors to listen, to say, okay, let's run some tests before we wind up at the ER like that? So that's, I don't know. I just find it very difficult. And the other thing I wanted to ask the question, now that we have all these health apps, right? You go get a test, blood work, and it shows up, and you see all the red levels and negatives, and then you go to the doctor, and they're like, oh, but it's fine. And you're like, okay, but I can see where my blood clotting factor is going lower, but you're fine. My EKG said I had a cardiac vascular event, but you're fine. Like, how do you get a doctor to say that you're not okay when you see these test results coming back and stroking you, and you can't get an answer?
And so much of that is education. There's a terrible shortage in neurologists. The waiting list to get in as a new patient is very long. And the education of internal medicine, family medicine for neurology is not even a required element. It is an elective. So if you're an internal medicine or family medicine doctor, you may have had 0 dedicated neurology experience during your training. And I can tell you that a lot of physicians and nurses are afraid of neurology. They just are. If you're not really experienced in it, one of the natural human characteristics of something you're not comfortable with is avoidance. So that's a problem, that there's not a deeper level of neurology training for all comers. Because stroke can happen to anyone at any time, including patients who are in the hospital for some other reason. And we call that in-hospital strokes. And there's evidence that shows that someone who's in a hospital has longer time from symptom onset to accessing the neurologist, longer time to imaging, to getting that CT to show blood, no blood, and longer treatment times and lower treatment rates. So there is an issue with that. And so educating your the healthcare providers who take care of patients is really important. Staying up to date on advances and keeping your team comfortable recognizing and responding when something ain't right, instead of hoping for the best. And like in the hospitals that I work in, even our custodial staff, our food and nutrition who brings trade patients, they're all allowed with any degree of suspicion to call a code stroke and let us figure it out. So education really needs to be enhanced. Access to neurology needs to be enhanced. The greatest way to access neurology in areas that don't have a high density of neurologists is through telemedicine. But who knows if that's going to be covered anymore. Like effective, I think, November 1st, a lot of plans aren't covering telemedicine anymore. Like there's telestroke. I mean, Ochsner, they're famous for like one thing. It's like their telestroke program has impacted well over 100 hospitals and enabled them to have access to premier stroke neurologists who can see through a camera in real time and help make decisions in places that don't even have a neurologist on staff. That is tremendously helpful. Being able to give that clotbuster in hospitals could be better enabled through having mobile stroke units. A mobile stroke unit is an ambulance that has a CT scanner in the unit. So patient gets on, they get a CT, if there's no hemorrhage, they can tele with a stroke specialist who says, no hemorrhage, asks a few questions, watches the exam and says, yes, give that patient the clot buster. That's been proven to reduce the onset to treatment time and has been proven to improve the chances of having an independent outcome from stroke. But those cost over $1 million to implement and over $500,000 a year to maintain. And we would have to have probably 12 in key areas of the state to be able to make, to make an impact that doesn't itself have disparities. So that is quite challenging, but those are potential ways. And so to advocate for continuation of coverage for telemedicine is so important. Because yes, there's the acute phase, but then there's also having access to a neurologist later on for other phases of your recovery and to help make sure that you're doing everything you can to prevent the recurrence. And that can be achieved through telemedicine.
Excellent. Advocacy.
So we have a few minutes left for questions, and I want to make sure that anyone in the audience, if you have a question for a panelist, to please go ahead and chime in.
I did. What's in mine? My story is very long, sorry. Very short. But the little test that he did is running around, and if we had a machine writing question with side because I've been associated and with all of the experience that the doctor has said, as spoke about, because this month, 2018, I had a sudden stroke in my sleep. It knocked me out of my bed at 6 o'clock in the morning. I was babysitting my granddaughter, who was 2 at the time, and I got up. I did not know what was wrong with me. But being in the healthcare field, I've been a medical assistant for 17 years. I'm a care coordinator now. And just trying to associate what was wrong with me. And the only symptoms I can associate was having seasonal allergies. Just did a rigorous exercise Friday. I worked at Baptist. I support a provider that was working for like a high-paced clinic, so I would walk my hour for lunch. Always did for the years. I would walk from the Napoleon to the School to Key, if you know what that is, almost like McLean, and get back. I would challenge myself. So it was just very added, just health conscious person. I got up. I called my daughter to let her know what had happened. I was on the floor. I didn't know what was wrong. She's in the medical field as well. We talked about, she came over. I made breakfast. I drank coffee. I waited around, the whole thing. I did the ABCs, looked in the mirror, I sang. The only other thing I can associate that stroke was being very sleepy and fatigued, just in and out of sleep. And my daughter was very concerned. She said, just take the aspirin, your pressure is normal. I did that, and she called my 2 friends, but very best, 2 good friends, and they came over and they said, please go to the hospital. Here are all worst interviews. I knew deep down something was wrong with me, but I did not know. And I was in such denial because I had no health history. I wasn't a diabetic, no hypertension. I didn't have anything. Wasn't taking any medications but vitamins. Until about 2 o'clock, I took a shower and I packed the bag. My friend was like, where are you going? Where are you going? I said, well, I work at Baptist. I don't want to put Baptist because, it's really not trauma. And the longer I waited, I was talking like really crazy. I was like, let's go to university. You want to go to university? Yeah, let's go. Take me there. And they took me to the ER, and they had a line out the door. He's talking about 2018. And then my other friend said, take her to main campus. So we went to the University of I did not tell them that I was an employee, which they could see. And They checked all my vitamins. I told them what happened to me, and finally admitted me that the EKG I passed the vitamins were good. And then they started asking me all the questions, what year is this, who's the president, all the things. I just going in and out of sleep. They said, well, we're gonna discharge you because your ear, we see a little fluid in your ear, associate that with, sinus. And as I laid there to wait to get discharged, I seen a resident that I knew in Interpret, and he said, what are you doing here? And I told him everything, and I said, I think I need a CT scan or MRI. They didn't want to give me anything. And he said, let me talk to the charge nurse and see. And then he convinced them to give me a CT. He said, they're going to do an MRI as well. I came out of the MRI, sleeping, and woke me up. They said, oh, Miss Franklin, I think you're in a stroke. Stroke? And I'm like, what is that? They're going to tell me anything. They admitted me to neurology on the floor. I seen several neurologists. Nobody knew what was wrong. And taking my sugar, my blood sugar, checking my blood pressure. My pressure was dropping. My sugar was getting lower. And the more somebody couldn't tell me what was wrong with me, the anger, the more I got upset. I started really losing it. I was just like the lady said, talking like those for Jamaica and all of the things. I just started losing my tone. And then finally, I made the hospital. It was Saturday. From Sunday to Wednesday, I spoke with the provider that I supported, and he said, send me authorization and let me look at it. And we said, you need a good INR specialist. And I seen an INR specialist on Thursday. He said, I don't know what's wrong with you, Miss Franklin, but we're gonna find out. And they found that I had an internal carotid web on the right side. So I had a little bit, the webs in my carotid was just like really slow. And I had a little pearl right there that climbed my blood. And he told me, had I been a smoker, a drinker, or even a fighter, it would have happened early on in life. And at this time, I was 50 years old, very vibrant. And found what was wrong with me. I had rigorous therapy, but two, I was denied. I had good insurance. I was denied therapy to a good facility. I was very young. I needed to continue work. I had a family to take care of, and I too was denied. I had to write an appeal. They was trying to send me to a nursing home, and I knew I couldn't rehab there to get back to work. This happened in November, and I worked up here, and I got approved for 7 days. And they took me that night, right down the street to Ochsner, be a patient rehab. And I went to work. I had PT, OT, and speech. And speech was the hardest part because I was denied. I could not believe that at 50 years old and all the things that I've gone through, and I was very healthy, then I had a stroke. And once I sit in that went to group therapy around all these people and just understood that the world comes in so many variations, meeting all of these people. And it's when I decided to accept, my diagnosis and just started to deal with it. Today, I only take 81 milligram aspirin to coagulate my blood. They had to have a stent for that place. And just to coagulate my blood, and today that is the only thing I'm taking for, my diagnosis. But if I ever be a stroke patient, and I'm not ashamed to tell people, And I'm an advocate of it, just with my patients, just try to get patients, involved in preventative health care. And that is something that I want to deal with. They kind of deal on a lot. I'm sorry, it's so boring. Yes.
And you all deserve better.
Well, first of all, I want to thank everyone who shared their story. I think there's a lot of power in patient stories, that there's different lessons that we can learn just by listening. I think today, this session was a perfect example of why we should just listen. And the second part is the important advocacy for yourself, family members advocating for you, as well as the providers advocating for you. So thank you. I don't know about you guys, but I feel blessed having been in the presence of these ladies, as wonderful like you. Thank you. So we're going to take